Hello everyone, welcome to today's wellness session. Today I'm going to continue our conversation about mental health as May is Mental Health Awareness Month. I'm going to be sharing some common behavioral characteristics observed in the school setting that may indicate that a student is struggling with mental health concerns and may warrant a recommendation for further assessment. These behavioral characteristics include lack of behavioral self-control in a school setting, such as difficulty sitting still, difficulty staying in line, blurting out answers in class, things like that. Another characteristic is refusal to do schoolwork or comply with an administrator's request. Another characteristic is serious conflicts within relationships. So in a school setting, that could look like conflicts with teachers, other classmates, or even administrators. Another characteristic is unusually high levels of stress. Another characteristic is negative emotional or behavioral response to situational stress, such as a divorce or a death, a move, things like that. Another characteristic is low academic performance. Another characteristic is physical disability that interferes with your academic or school performance. Another characteristic is when a student is experiencing difficulty taking responsibility for not only just their belongings but their actions as well. Another characteristic is low self-esteem that interferes with the student's ability to perform academically and interact socially. And the last characteristic is feelings of inadequacy as a result from having a learning disability or some other kind of mental health impairment. Schools are able to identify their most at-risk students by regularly reviewing student data. Some common student data that's reviewed on a consistent basis is attendance, office discipline referrals, grades, universal behavior and academic screeners and assessments, test scores, and school counseling and social worker referrals. For example, a student scoring at risk on a behavior screener who also has several office discipline referrals and poor attendance would definitely be considered a student that's at risk. Once a student is identified as being at risk, a parent meeting should be scheduled to determine next steps. Some examples of what next steps might look like could be adding in some kind of intervention at school to help with whatever the problem area is, or referral to some kind of outside agency for additional help or support, or some other kind of modifications or accommodations. Once the plan is established and everyone knows and understands their role in the student's plan, everyone being the parent, the teacher, school counselor, interventionist, outside agency, administrator, whoever was put into the plan, everyone needs to know and understand their role. Then follow-up meetings will be scheduled periodically for each member that was part of the plan to come sit down and talk about what they've observed or what they've been working on with the student, how the student's doing. The student would need to be a part of that as well, and talk about what needs to be added or changed or kept to keep the student on track for goal achievement and to ensure student success. In the example earlier, the student was experiencing difficulty with behavior and attendance concerns. So in this example, the team may decide to try out a behavior intervention for the student, like check-in, check-out, where he checks in with the counselor in the morning and in the afternoon before he leaves to talk about what the expectations are for the day, and then at the end of the day, how the day went. And all throughout the day, receive intentional feedback from the teacher to improve the student's behavior. Again, the team will meet periodically to talk about how this intervention is working and what needs to be modified or changed to ensure the student's success. Other examples may include a student who's struggling in multiple areas, and it's important to note that if a student is struggling with attendance and behavior and grades and some emotional, social or emotional health or something like that, then it's going to be important to only focus on a couple of the most significant areas, not try to focus on everything at once. So just try to improve one area at a time. As the team is meeting and the student is progressing towards their goals and even achieving their goals, it'll be up to the team to decide if and when the plan is no longer needed in order for the student to be successful. If a student is exhibiting some of these characteristics that we discussed in today's session, then I would encourage that student or their parent to reach out to a school administrator or school counselor to see what's in the best interest for that student. The Early County school system works hard to ensure that the needs of the whole child are met. And we do that by collaborating with students, teachers, parents, guardians, and other outside agencies to ensure that we meet those needs that are identified, because our vision is everyone committed to student success. Thank you for joining today's session, and I hope you'll stay tuned for our upcoming sessions.